So we have been completing SAY Systems reviews for going on 4 years now. And one of the things we really love about the SAY Systems reviews in Indiana is it really allows us to take a systematic approach when these critical incidents occur. But what's also really cool about it is it allows the frontline staff and their supervisors to have a voice about what is working and what is not working when they are doing the work with our children and families. So it allows them to advocate for their needs, and then we are able to pull all of that data together and advocate on their behalves.
What we've discovered is that there was a need to collaborate with someone who quite possibly already has rapport built with staff in our agency. So what we did was we developed a safety culture series. So it's a 4-part series where I have collaborated with a leadership advisor, and we really just go in organically and we talk about psychological safety. We talk about aspects of really connecting with individuals in the field, and we talk about really how to alter or change your approach to hard conversations that occur daily, not necessarily just with a critical incident, but just in daily processes that really can shift the culture of an agency.
Implementation is one of the biggest challenges that teams like ours face, because you do the review, you make these recommendations, and then maybe there's not money or resources to actually implement the change that you've recommended. But our team also manages our state's Children's Justice Act grant, and so we were really able to align the work of our Safe Systems team with our Children's Justice Act task force and leverage what, in the grand scheme of most states' budgets, is a very small pot of money, but able to leverage that to accomplish some of our recommendations. Another one of our big wins with the CJA funds was just through our critical incident response team, and that's an internal team that responds to help our staff process the psychological trauma that they experience in this line of work. So our CERT team had not had funding for training for about 12 years. And so we were able to come in with CJA and get our entire team certified in critical incident stress management so that we could really make sure we were using an evidence-based approach and helping our staff so that we can retain more staff and keep them in service and really retain that institutional knowledge that they bring with them.
In addition to this, we have been able to really ensure immediate successes for our staff so that they are able to see that their voices are heard and elevated. So 2 of the ways that we have done this is initially through a program called Space Education, where every Thursday morning we send out a short quiz about something that has been relevant to the themes of the reviews that we are doing lately, or an awareness month, to really ensure that staff are getting short bursts of knowledge to enhance their learning and their ability to work with the children and families. And then another example is when we were completing debriefs after a critical incident with our collaborative care team, so our team who works with older youth, we learned that many older youth were experiencing feelings of helplessness, suicidal ideations. So there are several QPR, or question, persuade, refer trainers in Indiana Department of Child Services. So we were able to train all of our collaborative care staff on that QPR model, which is a suicide prevention model, to help in their engagement when they were out doing their monthly visits with their older youth. When we have certain counties or regions that are not experiencing lower staffing numbers and their caseloads are really within those national standards, they're asking for volunteers, or they're creating deployment teams who are able to go in and help with some of those counties where those caseloads are a little bit higher, to support them through those crises.
I think another innovative thing that Indiana has done is the Safe Assessment Closure Team, so we call it SAFE Act. And it's really helped with that workforce shortage issue. So when a case manager goes out on an assessment or an investigation and they can tell pretty early on that the child is clearly safe and that the allegations aren't going to be substantiated, they call and staff it with a supervisor from the SAFE Act team. So it just frees up their time so that they can devote their attention and resources to a family that really needs them versus those kids that are clearly safe.